Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in the profession. So today we will be dealing about the topic is management process planning. So before setting up of any organization, we must have a skeletal plan. So what is mean by that skeletal plan? That means in the future terms, what are the objectives I am going to mainly focus on, what is the main purpose of setting up the institution, and what is the policies has to be followed in my organization, and what are the philosophies, what philosophy I am going to follow with. So these all are the management process planning. So in before setting up any organization, we have planning, right? So in that planning we have various steps like directing, coordinating, and selecting, everything is there. But in the management process planning, we have a different kind of planning process. That is, before setting up of any organization, we must have a mission and the vision statement. So mission means what is the main purpose of setting up the institution. Next is policies, objectives, and also philosophy. So in this video we will be seeing only about the mission, that is how we are going to plan and formulate the mission for the organization. So remaining like policies, objectives, and philosophies will be explained in the next video. So if we club these all together in a single video, it will be very time consuming in this video. So we will be only discussing about the mission statement, that is before any organization is being set up, how the mission should be, how the mission statement should be framed out for the organization. Because if we see the mission of any organization, whether it is a healthcare institution or educational institution, we will come to know that who all are the beneficiaries, so for whom the institution is going to work, so what is the main future target. So once we complete the mission only, we can focus on the vision of any organization. So we'll see one by one in detail. So introduction. Planning is the first step of management process and continuous intellectual process of determining the philosophy, objectives, policies, procedures, programs, and rules. So it includes various activities to achieve the future target. So I have already said, so before doing any programs or any setting up of any institution, we must have a proper planning. So we used to tell, like if you do the proper planning only, it will not cause any time consuming, it will not lead to any cumbersome process. So only we should do a proper planning. So in that setting up of any institution, the planning is the first process. So next is, we'll see what is mean by management. So management means it is the getting the right things done at the right time. So what is mean by nursing management? A relationship of inputs and outputs in which the workers, physical resources, and technology are emerged to bring about the organizational goals for delivery of quality nursing care. So in simple term, what is mean by nursing management means, for example, some patient is coming into the hospital, so we have to work, that is there should be a proper workmanship should be there, proper physical resource should be there, proper technology should be there to diagnose what the disease condition the patient is having, and in order to provide the quality nursing care. So that is the main meaning of nursing management. So we will see the mission. So we have seen what are the management process planning. We have already seen in the previous slide, that is mission, philosophy, policies, and objectives. So we will see in detail about what is meant by mission. So mission, it is being derived from the Latin word missio, that is act of sending. A mission statement is formal, short, written statement of the purpose of organization. It helps the organization to link its activities to the need of society and legitimize its existence. So for example, when I am going into any institution or any educational organization, the first orientation they will give is they will give us their mission statement, their vision statement. So by reading the mission statement itself, we'll come to know what is the main purpose of that organization. If it is going to be a healthcare institution, for example, in a mission statement, it is being stated that they are going to care the patients that is pediatric population. So what is the beneficiary of that institution is pediatric population. So next, mission is the highest level of description of why the organization exists and what aims to be achieved. So I have said, so by reading the mission statement itself, we'll come to know what is the main purpose, to whom and all they are going to give the render the quality care. That and all will be explained in the mission statement itself. So mission identifies the basic function of an organization or agency. So any hospital which is being set up is going to provide a quality care or specialized care like cardiovascular or any liver specialties like that, means they will mention in the mission statement itself, and we'll come to know what is the main purpose of that mission is. So now we'll see what is the purpose of mission. It defines the fundamental purpose of an organization. It is used to set out model of organization in future. So gives the answer of question what is to be done. So by mission statement itself we'll come to know what are the function the organization is going to set up. So what is the main purpose of that organization. So to whom and all they are going to give the care. Who are the main beneficiary of that organization. And what are the problems or need of the organization is. So what makes the organization a unique way. So they will formulate the mission statement in a very unique manner, that it is going to provide the main purposes and what are the future targets of the organization, and it will also identify what are the needs and problems of the organization, and who are going to be the beneficiary of the organization. So these all will be given in the mission statement. So this is the main purpose of mission. So by seeing the mission statement of the organization itself, we will come to know what is the main purpose of organization and why the organization is being set up, and who are the beneficiaries and what are the care they are going to give. So next is elements of mission. So the mission statement, which consists of purpose statement, that is only it is clearly stated in terms of goals. So what are their goal? So in a mission statement it is being stated that they are going to render the quality care to the mainly focus on the cath lab surgeries or any cardiovascular surgeries means. So that is the main principles of the mission. So next is characteristics of the mission is it should be short, it should be durable, that is time fixed. So short means it should not be more than 1 to 2 sentences, and distinctive, that is uniquely describing the organizational purposes. So these all are the characteristics of the mission statement. So the mission statement of any organization will not be in the paragraph form. So it will be very short, that is 1 or 2 sentences only will be there. So characteristics of mission is it should be specific, that is it should be towards the goal achievement. So credible, that is believable. So you cannot give any mission statement which we cannot believe at all. Without if it is not going to be achievable, we cannot frame that mission statement. It should be alive, that is known to everyone. It should have a clear intention and words to be known. No any complicated sentences or words should be there, because even a lay person when they read the mission statement has to understand it. Next is it should be feasible, that is neither too high to achievable or not too low. So whatever the mission statement they are having, so what main function they are going to function, what is the main activities that is going to be carried out in the organization has to be clearly stated out in the mission statement itself. So it should not be very confusing, it should not be very lengthy, and it should not be very confusion for even the lay person to understand. So even a non-medical person, if it is going to be a healthcare institution, means even the non-medical person, if they read, means they should get a good understanding. So next is precise and self-explanatory, that means it should not too restrict or not too wide. It should be unambiguous, that is it should be in the written form and should be known by the personnel. So whom and all working in that institution should know the mission of that hospitals or the vision of that hospitals, or whether it is a healthcare institution or educational institution, they must, all the personnel who is working there has to know the mission statement. So whenever you enter into any organization, in the first itself in the placard they will be mentioning what are the mission and what are the vision statement. So next is characteristics. It should be the statement of ethics, principles and standards to be included in the mission. So express the organizational mission and vision. a framework to formulate the organizational strategies and drive an organization forward. So a mission only is going to give us a small skeletal plan how the organization is going to move forward. A simple difference between mission and vision is, mission means the present in terms what they are going to do. Vision means in future, after completion of mission, what the future terms they are going to achieve. That is known as vision. So mission in nursing, the main mission of nursing is to provide a better quality of care, promotion of self-care concept, and arousing the leadership quality, and they are mainly focused on the quality of nursing care and focus on the unique need of patients and the families. So whether it is a healthcare institution or educational institution, when you just enter any organization, they will be displaying their vision mission statement. So that is the main essential for any organization if we just see it. So we will see about the other like policies, philosophy in the other videos. Due to a time constraint, we have been restricted to only the mission. We will see in detail about others in the next videos. Kindly subscribe the channel.